Now we are discussing about very important topic, vasculitis. These are the types of vasculitis. The first one is giant cell arteritis, in which temporal artery involved. Then second is Takayasu arteritis, polyarteritis nodosa, Kawasaki, venous granulomatosis, thromboangiitis obliterans, called as Buzz's disease too, and even some infection and other like autoimmune problems can lead to vasculitis. Now we will go one by one. Vasculitis mainly involve arteries, and the most common type is due to non-infectious autoimmune causes, in which we can get anti-neutrophilic antibodies or anti-endothelial cells antibodies. Even some drugs can cause vasculitis of small blood vessels. The first important arteritis is temporal arteritis. The giants, it is also called as giant cell arteritis, involve mainly temporal arteries, and age group comes under this older adults. Blindness is a feared sequel, and if you will take biopsy of the blood vessels, we will see granuloma formation, that is diagnostic. The patient ES are raised, and in some cases anti-neutrophilic antibody is also positive. In this picture we are getting temporal artery, and in microscopic picture the lumen of temporal artery almost obliterated. Here the lumen is not seen, only it's mean that it completely obliterated, and there is granuloma formation is seen. We can see some giant cell. Then next is Takayasu arteritis, which involve aortic arch and part of aorta. Takayasu arteritis mainly involve the arteries having elastic arteries, and most commonly in Asian women less than 40-year age. It is also called as pulseless disease. Giant cell also seen in microscopic finding of this disease. Here one is radiologic picture, and then one gross, and then microscopy. In radiologic finding we will see there is narrowing of branches of arch of aorta. Then in the cross there is almost lumen is get obliterated, and in microscopic finding the lumen is not visible at all. Some giant cell and some inflammatory cells are visible in microscopic finding. The third one, which is periarteritis nodosa. Before whatever the two things we have discussed, Takayasu and giant cell arteritis, both involve the larger arteries, while the polyarteritis nodosa involve mainly medium size of arteries, which are in viscera, and it can cause infarct, aneurysm, and ischemia. Etiology is mainly autoimmune. There is segmental transmural involvement of the blood vessels, and blood vessel wall shows fibrinoid necrosis. Anti-neutrophilic antibody sometimes seen. This is microscopic picture of polyarteritis nodosa. we can very clearly see the wall of these vessels surrounded by mainly inflammatory cells, and the wall itself showing hyalinization, that is fibrinoid necrosis. Then Kawasaki disease, the mainly children's less than 4 year involved, and coronary arteries affected by this disease. In USA, Japan, it's very common. The mortality rate is about 1%, and the patients show red tongue. Adenopathy is also common. Anti-endothelial cell antibody can be seen in this case. Then the small arteries vasculitis are microscopic polyangiitis, hypersensitive vasculitis, and leukocytoclastic vasculitis. They involve capillaries and sometimes veins too. Fragmented neutrophils seen in this case, which are called as leukocytoclastic nuclear dust. Most of the allergies like penicillin show this type of vasculitis. In this microscopic finding, we can see numerous neutrophil nuclear fragments in nuclear dust. Then vaginal granulomatosis comes under small vessels vasculitis, mainly affect male more than 40 years of age. Acute necrotizing granuloma formation is also seen in upper and lower respiratory tracts. Often renal involvement is seen with in form of glomerulonephritis. Crescent formation is very common in this. Patient will present with renal as well as respiratory problems. Anti-neutrophilic cytoplasmic antibody is positive in this case. In this picture, we are seeing lung involvement and in form of gross as well as in CT and X-ray finding. Then thromboangiitis obliterans, which is also called as Buzz's disease. It is 100% associated with smoking, more common in male, and the age group is about 30s and 40s. Often arteries are 100% obliterated, so name is obliterans. Extremities are most often involved, and due to obliteration of arteries, the extremities